So, ladies and gentlemen, dear colleagues, welcome to this press conference to go over the situation in Quebec about COVID-19. The Premier of Quebec, Mr. François Legault, is together with the National Director of Public Health, Dr. Horacio Arruda. Mr. Premier. Hello. Hello, everyone. Thank you very much. First, I am happy to find you again. I wish to thank the Deputy Premier, Geneviève, who replaced me yesterday. I apologize with my mother. I had forgotten to tell her that I wouldn't be here yesterday, so she got very worried. I'm not sick. I'm in very good shape and happy to be back. It is the turn of the Minister of Health to have a day off today. She has a long day tomorrow with the opposition and has to get ready. So I am with Dr. Arruda, who is further than 2 meters away from me. So we're respecting the guidelines. Let me start with the numbers of the past day. We have 98 new deaths, a total of 1,859. I wish to, of course, offer my deepest sympathies, my thoughts and my condolences to the families, the loved ones. Although we announce new deaths every day, it's always real people with real families, so it's very difficult. Perhaps a clarification. It's not because of the people, depending on where they come from, are more important or less so, but just in order to do a follow-up of the situation. Out of the 98 deaths that we had yesterday, 92 of them were people who lived in the residences for long-term care. And so 6 lived in the population at large. Excuse me. I also wish to clarify one thing. Since the beginning, I've been trying to tell you everything, to tell you the truth. When we look at the situation in the CHSLDs, right now we have 4,400 people who are infected with COVID-19 in residences for long-term care. Of course, we are going to do everything to try to save a maximum number of them, but we do have to be realistic. There will continue being many deaths, unfortunately, over the next few days and weeks, because there are 4,400 infected people, so it's very difficult to give a ratio. I've tried to do that with Dr. Arruda, but it is very difficult to predict. But what we can predict, unfortunately, is that there will be more deaths. Perhaps also to tell you that those 4,400 people who are infected are concentrated in 280 residences. So out of 2,600 residences that we have in Quebec, CHSLDs, our PEAs, and RIs, there are 280. So a little over 10% that are infected. The others don't have cases of infection. So, of course, when we're talking about the staff that we're adding and the attention that we bring, we are concentrating first and foremost on those 280 residences and those 4,400 people who are infected. And, well, I prefer telling you that it's probable that, unfortunately, the death toll over the next few days and weeks is going to continue being high in the case of residences and CHSLDs, which also brings me to another clarification, because I'm still reading a lot of articles where people are making comparisons with elsewhere in the world, other provinces, other states, other countries. We have to be very careful when comparing, because there's a lot of places where deaths are not declared, the deaths that take place in long-term care facilities. And there's a lot of articles that are written where what is said is that once the crisis is over, we will be setting up the method that is called in English excess deaths, where what will be compared is the number of deaths during the period of the crisis with the same periods of the preceding years in order to see how many real deaths are linked to COVID-19. And according to many specialists, there may be in many countries and other places in the world There may very well be bad surprises. Here in Quebec, and we've always been reputed for that, even when there's, heat waves or there's other problems that we experience, everything is declared. Whether people were tested or not by epidemiology. I can't even pronounce that word. I hope to be able to by the end of this. But we declare all deaths. I'd like to get back to the cases and hospitalizations. We have over 27,000 confirmed cases, 1,684 people who are being hospitalized. That is an increase of 36, 214 people in ICU. That is a decrease of 8. Now, when we look at the hospitalizations, 1,684, we had already told you that we had, at the very beginning of the crisis, that we had freed 7,000 beds. It has to be understood that a good part of those 1,684 beds that are occupied are in the Montreal region. So we are following the situation very closely. In Montreal, we've seen it over the past few hours. There are 3 hospitals that have caused significant problems. Maisonneuve-Rosemont, Lakeshore in Pointe-Claire, and the Douglas Hospital that receives people who suffer from mental health problems. So just to say that there's a lot of patients who were taken out or are being taken out of those 3 hospitals in order to be sent. As we had said, we've reserved hotel rooms, like, real hotels like Best Western or Place du Puy, and we also have reset up l'Hôtel Dieu. So we are taking a lot of patients out of those 3 hospitals in order to be able to start over again, if you will. So big cleanup, disinfection that will be done. And we are optimistic that we'll be able to, in the course of the next few days, to take control back in those 3 hospitals. Now, there is also a situation which is worrisome in Montreal Nord. A lot of people are infected. It's probably the sub-region in Quebec where there is the highest number of cases. So those who are responsible for public health are in the field right now. They have started doing test follow-ups of the people who were met by those people who tested positive. And over the next few days, we will significantly increase the numbers of tests made in Montreal Nord. Now, speaking of tests, first, we are now in Quebec at 214,000 tests. If we want to compare ourselves and compare comparables, and we can do that for the tests, that means that we have done over 25,000 tests in Quebec per million inhabitants. I'm giving you a few examples. In Ontario, it's 18,000. In the U.S., 18,000 per million. In the United Kingdom, 12,000. In France, 7,000 tests per million. We're at 25,000. And what is predicted, or what we are planning on, right now we're doing about 6,000 tests per day. But as of next week, we'll be going to 14,500 tests per day. And in the weeks following, we're going to increase that even more. Dr. Arruda will have the opportunity over the next few days to explain to you what that plan is all about. Now, I also know that many people are concerned about the deconfinement in Montreal. We just said it, the situation is pretty much under control as soon as you leave Montreal. But in Montreal itself, there's still hospitals where there's a lot of beds that are occupied. So the leeway is not as great in Montreal. Just to let you know, and to remind you as well, because a lot of people think that we are reopening tomorrow morning. I'd like to remind you that businesses in Montreal, what we are planning on is that they will reopen on the 11th of May and that the schools in Montreal will open on the 19th of May. Today's the 30th of April. Concretely means that we have 11 days for businesses and 19 days for schools. And I just wish to say, we're going to give the go-ahead only if all the conditions are met before those dates. And the conditions are the same pretty much everywhere in the world. The WHO gives 6 conditions that we're following very closely. So the epidemic has to be under control. We have to have sufficient number of tests and be able to conduct them. We have to pay close attention to the vulnerable, as we are doing right now in Montreal Nord. There has to be measures set up in work environments. We have to make sure that nobody arrives from the outside, and we had Mr. Trudeau's assurance on that. And we must mobilize communities, and that is what I do almost every day. And I also wish to reassure certain people on the independence of Dr. Arruda and public health. I would even say that it's the opposite. I find myself very docile. I am myself very docile in relation to Dr. Arruda. I listen to him as if he were my mother. So I just want to reassure you, I do not have undue influence over Dr. Arruda. I listen to him. I am docile. Now, the health staff. I heard earlier on the nurses. I understand very well that some of them need rest, and we are doing everything to try to fill the positions of the people who are absent. And I just want to give you an overview. We are at 10,500 people who are absent in the entire network. We are now at 7,200 people that we found who now work thanks to Je Contribue. So that's very good news, particularly because I am told that the vast majority of those people wish to stay after the crisis. So very good news for everyone. That's very encouraging for the long term. We also have 1,200 students and teachers who are in our establishments right now. We have this morning 241 soldiers in total who are in our establishments, and we plan adding 276 more. So if you add all that up, it's not 10,500, but what we have to remember is that we're doing less surgeries right now. So there's staff that usually was in the hospitals, but that was transferred. I think that we have about 120 doctors, and there's nurses and orderlies who were moved from the hospitals to the other establishments, in particular CHSLDs. And we continue with recruitment. And I continue telling people, go and register. All those who are ready to come and work in our CHSLDs, who are ready to come and work full-time, people who are retired, who want to come back. It's now or never. We need you. But I still wish to say that most positions right now are filled. So what we have left to do is to tweak things a little bit because it's not perfect, but the situation is improving. So I wish to tell the nurses, we understand that you have the right to take vacation. You've earned them, very much so. It's just about working together to see how it's going to unfold. Now, I'd like to get back now to the guidelines. Yes, we've made a plan. We presented it. It's a deconfinement prediction, particularly in Montreal. I'm not too worried for the other regions. But for Montreal, it is very important, if we wish to be able to start deconfining in Montreal, first, that there be no gatherings. I know that there was a sort of debate about this yesterday on, the interpretation of the laws. But beyond the interpretation of laws, we don't want gatherings. So with your neighbors, with your friends, with your family, please, if we want to be able to deconfine, particularly in Montreal, no gatherings. The fight is not over in Montreal. And I want to repeat it. I said it when I announced the dates for the schools and for businesses. If the situation deteriorates, there will be no opening in Montreal. And I won't hesitate. I'm not going to take any risks. So really, you have to respect the guidelines if we want to gradually come back to a slightly more normal situation. I'd like to end with my daily thanks. I wish to thank the people who take care of the vulnerable children. You know that it's a very sad anniversary today. A year ago, we heard the story of the little girl from Granby, who I think touched the hearts of all Quebecers. Since then, first of all, I wish to say that we added budgets and positions. There are positions of workers pretty much everywhere. I know that all the positions were not filled, however, and we are going to continue doing so. It is also important to say that the waiting lists in the DPJs went down even before the crisis. We have to be prudent when we look. Yes, they did go down during the crisis, but that's because there were less people who were called. So we had to be careful with that interpretation. But I want to offer my daily thanks to the pediatricians, the nurses, the social workers, the educators, all the people who work with and in our DPJs. And thank Régine Laurent and the commissioners who continue their work and who continue giving us recommendations so that we take better care of vulnerable children. And one of the ways to help those children is to send our children back to school. Of course, right now, there are less reports, but one of the ways of finding the same level of reporting as before is to send those children back to school. So if there's still people who are hesitating to follow the guidelines, well, do it for the vulnerable children, because if we cannot deconfine, particularly in Montreal, we will continue having these children who will be abused and that won't be reported. So if you do it for no other reason, do it for the vulnerable children. It is important that they be able to go back to school. I'd like to end by saying we still have a lot of efforts to make, particularly in Montreal. So it's important, if we want to succeed in meeting the objectives and the plan that we've given ourselves, that we respect the 2-meter distance with other people. If ever we think that we may not be able to respect the 2-meter distance, wear a mask. And it is also important to be careful, particularly be careful with people who are 60 and over. It's not because I don't love you. People 60 and over, it's just because I want to keep you with us. So I'm counting on you for things to go well in the month of May, and I thank you. English.
Good afternoon. We're currently verifying if there is transmission in a certain neighborhoods of Montreal, in Montreal North, for example. The Montreal Public Health Authority is applying a strategy of test and investigation in this zone. I want to be clear. We've announced our reopening plan, but it's not starting this week. Gatherings are still forbidden. It's not the time to stop our efforts of social distancing. It's time to be more disciplined than ever. If we stop our efforts and the situation doesn't improve in Montreal, I won't hesitate to push back the reopening. So I'm counting on you all. Thank you.
Merci, Monsieur le Premier Ministre.
Thank you, Mr. Premier. So for the question period now, we will start in French with Olivier Bossé of Le Soleil. Hello, gentlemen. I would like for you to explain to me how I can prevent my 10-year-old son to not play with a neighbor, but that in a few days there are going to be 15 in the same room. Well, I can start by saying what we want to try to do is to have fewer children in each class and to tell the children and the parents and teachers, stay 2 meters away. And if ever you go less than 2 meters from somebody else, it shouldn't last. Don't stay there. I think that this is important. So in the same way, a 10-year-old child has to have it explained to them that it is better to always be 2 meters away from other people. And perhaps if you allow me, Mr. Premier, one of the things as well that I want to say is when we talk about the Montreal region, we're talking about the metropolitan area of Montreal. I don't want people from Laval to interpret the guidelines that the Premier just gave to us and that they think that they're not applicable to them. It's all the area around Montreal as well. This is the hot zone. The cold zones are really further to the north, east, west. So there's one thing to be understood. In the processes that we're going to be setting up for the schools and daycares, it won't be the same processes that we had before. Workers are going to be wearing masks. We also have to understand that we know that the people who are going to be there are people who are not susceptible, whereas your neighbor, I don't know if he has a grandmother or not, etc. So we also have to see this reopening. It's almost we stopped. We defined who the essential workers were, who were people who were allowed, etc. So we have to see this deconfinement that we're doing right now with daycares, with certain sectors of activities, as being a new definition of essential workers. It doesn't mean that we stop the guidelines. And that's major because the quantity, the reopening is going to be given a certain dosage to see what can happen with that movement and how we can intervene. If you start gathering all over the place, we won't know anymore where it comes from. So it's very important to maintain that approach. And as the Premier was saying, who's very meek, we are going to be applying the recommendations of the World Health Organization, but we already see a certain loosening. I was told a few, COVID-19 parties, like some people have for measles. There are things that are slackening, and I don't want it to become significant because that is really going to make it all blurry, and we won't know where things come from. It'll be community transmission that won't be linked to the reopening. That's why we have to go step by step, because when we open up, businesses, we want to be able to control it there. But if the person having, a COVID party with them, like they do for chickenpox, if they catch it, then we're complicating our populational diagnosis. So it's very important, as I said, that the population respects the prescription that we gave. Your colleague from the Estrie Region, the Director of Public Health, said himself that he believes that it is time to think about deconfining people who are 70 and over who are in good health. Of course, we're not talking about people who live in CHSLDs. What do you think about that? I also think that we have to study this, particularly in cold zones as well, compared to what's happening in Montreal. But taking into account, and I know, and I'm very conscious of the problems that this brings between families. I think we're going to get back to you with guidelines in the next few days, but it's too early right now in the deconfinement period, which could be interpreted any which way. So we can't do that yet, but we are analyzing it, and be assured that our objective is not to, to keep you back, just to keep you back. It's to keep you back to know what's going on and understand what the transmission is, what the dynamic transmission is. And it's very important. It is one of the conditions of the WHO. A question that comes from a specialist, a doctor. Right now, it's not possible to go back to a residence or a CHSLD or to send a patient back who was there, who got COVID-19, but who passed 2 negative tests. Before opening the businesses and schools, which is going to bring an increase of the cases, the doctors are wondering how to manage the beds before extra ill people show up. How is it possible to send back those people who are older, who are cured, but who are still there? Well, generally speaking, we want to, and I was talking about 3 hospitals before, but we want to send back certain patients either in hotels or in CHSLDs where they were. But of course, taking into account the situation that we are experiencing in CHSLDs, we thought that it was good to keep them for a certain amount of time at the hospital, but eventually we are going to have to send those patients back to find the level of operation that we had before in hospitals. And we've started, that either in hotels or new beds that are being created at L'Hôtel Dieu, etc. I'm talking about the metropolitan area right now because we have to maintain that capacity, of treating our emergencies and semi-emergencies as well as receiving other patients who will be coming probably due to the deconfinement measures. And together with my colleague's question, you perhaps saw, but there was a regroupment of residences for the elderly is also asking for the deconfinement of their tenants. They are worried about their psychological distress and are asking an announcement and a plan as quickly as possible so that they can at least plan the deconfinement and set up measures. What will you be answering to them? Well, what I'm answering is we will do it as we did it, with our energy since the month of January. They've been working with businesses and industries. We have to be able to give guidelines to those private residences or residences for the elderly so they can have a plan. That's part of the instruments that we wish to set up to be able to support them as such so that they can understand as well what it means. And also, we have to communicate well with the people who live in those residences because, there's phenomenon as well of denunciations and fear that can even hurt the social climate within the residents. And that is why we wish to do it with a plan and a communicational approach that is adequate. Otherwise, it could become, a free-for-all.
Bonjour, Monsieur le Premier ministre. Bonjour, Monsieur Arruda. 98 morts, on est dans
98 deaths. We are in big numbers and have been since the beginning of this pandemic. We are reaching almost 2,000 deaths since the beginning of the pandemic. It's higher than the optimistic number that you had given us in your graph. The deconfinement is going to be starting within 2 weeks. At this rhythm, with the deconfinement, is there not a risk that there will be 2,500 deaths that will be added in May? First, as I was saying, and as I showed on the graph that I presented to you a few days ago, we are experiencing 2 different worlds here, 2 different realities. Today, out of the 98 deaths, 92 of them come from CHSLDs and the residences for long-term care. 6 come from the population at large. So, unfortunately, and that is why I preferred saying it earlier on, we still have 4,400 vulnerable people in CHSLDs and other residences who are infected. So unfortunately, we can expect over the next few days to have other deaths in CHSLDs. But we also have to look at the situation in the rest of the population. We have to look at the situation in our hospitals. Our hospitals in regions outside of Montreal, the situation is under control. In Montreal, we're doing a very close follow-up, and as I was saying earlier on, before we reopen businesses on the 11th of May and schools on the 19th of May, we're going to make sure that the situation is well under control in our hospitals in Montreal. So that is why we have to look at things properly and in detail. But once we deconfine, Mr. Premier, in the cold zones in other regions, there will be cases. Will you be able to have the capacity to treat those people? Well, that's what we want to make sure of. We want to make sure that if there are people who are infected and who need care, that we have that ability in the hospitals. Right now we have it. And it is done gradually. That's what the important word is, gradually. So every day we're going to be looking at the results. And if we see that the pressure is too strong on hospitals, well, we're going to slow down the deconfinement, and we're going to really go according to the degree of control that we have in hospitals.
Bonjour, messieurs.
Hello, gentlemen. You talked about the situation in CHSLDs and residences for the elderly. Mr. Arruda, the Quebec regroupement of residences for the elderly are worried to see the children of the employees go back to school, knowing that they could get infected and bring back the virus to the residences for the elderly. Are you asking the CHSLD staff and residences to not send their children to school or daycare? To my knowledge, that has not been brought as being a criteria as such, because it becomes what we call a contact of a contact. People who go to work in CHSLDs are going to be wearing protective equipment as such. So, I mean, if we start going through that entire list, we would end up with problems probably of labor force. But of course, what is also important, and also to be able to answer the other question as well, people who have complications and who are hospitalized, it's possible that there are young people, but people who are in a work environment or, who are let go as essential or who go as essential workers won't necessarily have important conditions. We are trying not to have people above 60, etc. So if there is a transmission, it will be a transmission that won't necessarily have as much impact as what we have with the drama that we can see in CHSLDs, because these are people with very high risks. So in the facts right now, the guidelines are going to be pretty clear, and the people who are going to... And there's also debates about this as well, on the transmission as related to children. Do they transmit a lot or not? Usually with influenza, we say that they transmit a lot, but now there seems to be a study from elsewhere that show that no. But we are keeping a very close eye on the situation as such, as well as, possibly if there is a child who is ill, and a healthcare worker who gets ill, we're going to intervene. Mr. Legault, we're talking about deconfinement and returning to economic life. Is the money of Quebecers that will be used for the economic recovery, could it go to businesses that are here but who place their profits in offshore tax havens? If you don't want that, what are you going to do to prevent it? Well, that's part of the criteria that are going to be examined. We want for companies to pay their taxes in Quebec. There are exceptional cases where in certain industries, certain shares to avoid double taxes are in countries where they allow not having double taxation. So we have to look at it on a case-by-case, but generally speaking, I think that it's very important if we help a company that this company does pay their taxes here.
So deconfinement in 11 days, the situation has deteriorated even just since Tuesday. So 30th of April, 1:35 p.m. Is it realistic to have deconfinement measures in Montreal in 11 days? Well, listen, I don't have a crystal ball to know where we're going to be in 11 days. What we do know is that the situation is relatively stable but critical. But we have to keep an eye on things. We have 3 hospitals in Montreal that have had problems, and you can see that the number of hospitalizations is not moving much, particularly in intensive care. It has to stay that way. And we have to make sure as well that the number of cases, the regions or sub-regions like Montreal Nord, that the situation comes back under control in those areas. So I can't tell you. What I can, however, declare today is that before opening businesses on the 11th and schools on the 19th in Montreal, we are going to make sure that the situation is under control. And if you allow me, Mr. Premier, it would be interesting to be able to tell you exactly what's going to be happening and to be able to tell you. But when people reopen, we want them to reopen in different conditions. So we want them to prepare themselves. We prefer to let themselves prepare themselves adequately for the 11th. If ever it's later because the conditions are not there, at least they'll have done the work that is necessary. Because if
right now we say we're not opening on the 11th. The areas that have to get area, because I would like for you to understand that we're not going to have the same daycares as before, we're not going to have the same schools as before, and we're not going to have the same manufacturing industry as before the crisis. This is truly an issue where we want to maintain social distancing as much as possible, protect people if they can't, keep to the 2-meter distance. If you take the metro and you're wearing a mask or a face covering, as you were told, it's going to be it's going to be a new society, and that society has to prepare itself adequately. So I'm not telling you that we are making people do work for nothing. At some point, we do have to reopen this entire process, whether it be in September or now. And so it makes people think. People exchange perspectives to reopen differently, and I think that this is also important. Dr. Arruda, therefore, we understand that 14,500 tests per day, you've been saying it for a few days. How are you going to do that? Because we're still at 6,000 right now. So can you tell us how you're going to do it? We're not going to go into details because you will have the opportunity of asking me questions on that very briefly. But already the situation that is taking place in Montreal Nord right now, the Director for Public Health is going to be opening what we call not only evaluation clinics, like what we did recently, but screening clinics. That is being organized, and we are making a plan with all public health authorities, and it is clear that once we deconfine, we are going to be testing the environments that will have deconfined very significantly. And as I've told you, right now we have an availability of 14,500 tests that we can switch on tomorrow morning. However, we have to use them correctly. If they're done any which way, for example, in cases where there's not a lot of cases, the positive rate is going to be very low. We've always had, high rates of positive tests, 15, 60%, which is a good indicator. It means that we are using the test in the right places. But it's clear that it's going to be broadening and not just, in walk-in clinics, but it's going to be, screening tests in certain areas that have symptoms or not in certain regions. We learned this morning that Quebec was almost a victim of a fraud of tens of thousands of N95 tests. It ended up in front of the Superior Court. Have there been other similar cases where Quebec paid for equipment that they never received? And do you estimate that the CHU of Quebec in this case did its verification correctly? According to the information that I have, there's no other similar cases. I think that the chances are pretty good to be able to recover the total amount of money. The court did give its agreement for the money to be blocked, so right now the money is frozen, that 45 million. So we believe that the chances are pretty good of being able to recover the money. Now, you cannot imagine the thousands of people who called us over the past few weeks telling us that they could find N95 masks. We had to, in fact, in certain cases, give the money ahead of time, sometimes even in cash in China. Anyway, I think that we were in a specific situation, but I do believe that the chances are very good that we're going to recover that money. Mr. Arruda, I'd like to come back to the testing strategy. This morning we could read that certain Quebec experts in public health who estimate that Quebec does not yet meet the 6 criteria that you talked about, Mr. Legault, the WHO criteria for deconfinement. I understand that it will be announced perhaps in a few days, the testing strategy, but could we have an overview of what will be announced, what will be the strategy, and will there be a strategy to trace back the transmission chains? Yes, listen, it's not because we're deconfining that we are going to stop what we call the research of cases and contacts approach, which is one of the categories of the WHO. Yes, we'll be able to do it as soon as there's an outbreak in a school, for example, there's symptoms and we have to intervene, we will. In other cases, we might have random tests as such. We will be seeing to this, and it will be done. I understand that people haven't seen it right now, but we are, tying all the loose ends, and we are going to have tests in hot regions, but also in cold regions, because we want to monitor our things, developing elsewhere. We have to have the capacity, because thank goodness we shouldn't have any as of today. I've always said that what I say is true when I say it, but we shouldn't have any problems with reagents or swabs and lab capacity. I don't want to announce things that are that haven't been validated yet, but there's going to be further lab capacity so that we will be able to respond and answer to the criteria of the WHO, even if people in the field don't have that impression. And as I said, beyond what is going to be used for the treatment of patients, there are going to be tests reserved for investigations of cases and contacts, and others that are going to be reserved to document what is in the population. That is going to be managed by public health authorities, and later these seroepidemiological studies and inquiries that we'll be conducting. There are many people in regions. There's a sort of split feeling. People are happy with the deconfinement that's coming, happy that the regions are going to be open, that is going to allow for freer circulation. But at the same time, they're very worried that this deconfinement may make it that people from Montreal will take advantage of it to go to those regions. Are you considering, taking into account the situation that you talked about, Mr. Legault, and you said that it was critical in Montreal, to confine certain regions of Montreal to avoid that there is that sort of exodus towards other regions of people who are in hot zones who would go into cold zones? Is that being considered? The Premier said it. We are removing certain roadblocks for reasons of ease, so that essential workers, the new and the merchandise can, move around. We're not saying, well, here we are, Montreal, you can all go to eastern Quebec because over there it's paradise, there's no virus. That's not where we're at. If people have the impression that there will be that kind of movement and that we'll be doing it now, the answer is no. What we are deconfining, essential workers or essential elements. The definition of that is becoming broader progressively, but for everything else and everybody else, it remains guidelines that we have given and that we'll be adjusting. Because if we open up too much at the same time, we might send sparks out or even propane in the middle of hay. We're going to have a hard time controlling the situations and putting out those fires. So I know that it's going to be difficult because, some people are thinking, well, if children can go to school, why can't I do this? Well, that would be why we would have problems. And don't forget, we are not, theoretically letting people at risk out. People with chronic diseases are not going to go to work, unless it's essential work or something like that. But the message is, and I'm telling you, if we feel that people are moving around, if we feel that the population is not following us and that we're losing control, I can tell you that we can come back to stop. And I don't think that wouldn't be a good thing, because we would probably, totally, ruin our month of July, for example, if we don't do this. You're not answering my question. My question was more to say, are you considering confining Montreal, of preventing? We talked about that at the beginning of the pandemic. You had said, in fact, that it was something that could possibly be possible, confining Montreal, because most regions were confined, but Montreal never was. Could the reverse be done? Are you thinking, is there a plan? Okay, we'd have to have an indication, a specific idea of a transmission rate in one place. If we show, for example, because you have to see that Laval, we're talking a lot about Montreal, but Laval is just as much of a hot spot as Montreal. There's even communities that are similar in Montreal, or in Laval, I'm sorry. So first, it's going to depend on whether it's feasible, first. And second, if we have a specific epidemiology, we could, of course, confine a neighborhood, technically, but it has to be discussed with the Director of Public Health, and we have to have epidemiological reasons to do it. But if that confinement is impossible because the zone is already entirely red, well, because what we also don't want is that everybody from Montreal goes up north or east. Right now, we don't have that indication that that's where we're at.
La prochaine question nous provient de Marco Belair-Serino du journal Le Devoir, Quel est le nombre
What is the number of beds that are occupied and those that are free for COVID-19 students? Also in ICU care in hospitals of the Montreal area, how many beds are going to be put aside for patients that will be declared positive during the deconfinement? Hold on a second, I'm going to have a look. What I can tell you is that there are many beds, around 1,588 that are people NSA. They're no longer actively in the hospital and who could free up space at what we have right now, and we are decreasing that. So in the course of the past data, there's about 100 people who were positive to COVID-19, and they were in a situation where they could go outside. So those people are going to go towards what we call transition zones. They're not going to be sent back to their CHSLD, but, to get better care. Right now, we still have a capacity of 1,700 beds, if I'm not mistaken, in Montreal, and also around 147 are occupied right now in terms of ICU, and we've freed up 1,571 beds in Montreal right now. Thank you. The Interprofessional Federation of Health of Quebec says that nurses are exhausted. Are we going to have a new scarcity of staff in hospitals and CHSLDs? Well, of course, as I was saying earlier on, the fact that we have 10,500 people who are absent, it puts pressure on the network, but the fact that we added 7,200 people through Je Contribue, plus the students, plus the soldiers, it removes a part of that pressure. What I'm hoping in the course of the next few days and weeks is that in the 10,500 missing people, there are many who were in a quarantine, even if it's for 14 days, who are finishing up the 14 days. So I hope that they're going to be coming back to work, and that will help the people who are working right now. But I understand very well that the nurses are exhausted. They've been short on staff for a long time. They need rest, and we're doing everything to try to bring as many people as possible in those establishments. Thank you. English questions.
Good afternoon. Testing is a key part of the confinement strategy, but we're missing details, like key details, such as where will the testing and analysis be done? Who would do contact tracing, and how serious are you when you say that all this strategy in Montreal, for example, can be scrapped by gatherings?
In fact, when you get gatherings which are, I would say, not permitted, I think it would be more difficult to get the information for where people were infected. If we get a school where there is infection, if we got a workplace where there's infection, it's going to be easier for us to do our enquete and try to have the contact tracing and everything. So I don't know how much people will collaborate and say, I was infected probably in that party inside of this place and everything. So those cases are going to be contaminating others and others. So it's why we want to know where it's open, where people will have probably get the disease if they are not getting in the community. Imagine if we get to analyze all those things. It's why, at the same time, you must understand that the people that we are putting together or in workplaces are low-risk people. I don't ask people with immunocompromised disease to go to work the same way. And the work is going to be different from the way it was before. We will keep the 2 meters distance or have protective equipment. I'm not so sure that in social things in-house, meals together with 2 or 3 families, that it's so not normal to stay 2 meters away when you have a dinner, that probably the risk there is going to be higher, and it's more close contact, more long time together than it's going to be in the workplace.
Second question?
I would like to hear your strategy for Maisonneuve, Douglas, and Lakeshore, starting over again. I'm not quite sure I understood well. And how can you guarantee the hospital system, well, the situation is under control? I heard you saying it's critical when staff and patients are still moving between hospitals and, well, hotel rooms now and seniors' homes.
Okay, for those three hospitals, Maisonneuve, Rosemont, Douglas, and Lakeshore, we're transferring patients from these hospitals either to hotels, regular hotels like Best Western or what's the name of the other one, the Place du Puy, or at the Hôtel Dieu also that has been reorganized to receive those patients. So that's the first move. It's done. Like, for example, I think at Maisonneuve-Rosemont, it's more than 70 patients that were moving. So it helped the situation. It's not always easy. You know, Maisonneuve-Rosemont is like a cross, so you have in the middle to be careful. We're washing, disinfecting all the place before getting other patients coming in. So we're really putting all the energy to make sure that the situation is under control. And we're confident that in the next few days at those three hospitals, Maisonneuve-Rosemont, Douglas, and Lakeshore, that the situation will become under control.
Thank you.
Is it under control overall in the hospital system? Is it under control?
But it's tighter. When I say that we have 1,600 beds that are used, a good part of that is in Montreal. So we have to be careful. I don't want tomorrow to have 3,000 or 4,000 people hospitalized. So it's not easy. And the margin is tighter in Montreal. So that's why it's very important between now and May the 11th and May the 19th to see the situation under control.
Next question, Samuel Pouliot, CTV.
Hi. Construction of the REM commuter train project is set to resume, and shuttle buses will be used when the Montreal tunnel closes. With the COVID pandemic, how can you ensure the safety of concerned passengers?
Of the passengers?
Yeah.
But we already said that when you use buses, metro, that it's better to wear a mask. If you cannot stay at 2 meters of the other people, it's better that you have a mask. So this is a recommendation of the public health.
And with the respect of the $45 million that the CHU Quebec spent for N95 masks that were not delivered, what safeguards are in place to prevent fraud like this kind of purchases, especially when concerns were raised by 2 banks? And why was the purchase authorized without further verification?
First, we have to understand that there was a special situation where everybody in the world were looking for masks. Some vendors, they were looking for money before delivering the goods. But I'm happy to see that the $45 million has been freezed. The court has a permit that we freeze the money, so we're confident that we'll recuperate the $45 million.
Thank you. The next question is from Raquel Fletcher, Global News. It's for Mr. Legault. Opening up the regions and businesses has created confusion among people. Are you going too fast? What are you going to do about all the questions people are now asking?
I think that was the idea when we tabled those plans, was to give the people the time to digest, to understand, to ask questions. So some people, they think that we're reopening tomorrow. It's not the case. It will be done gradually in the next few weeks, first in region, after in Montreal. And if from now and the opening of the different companies or schools, if we see that the situation is not under control, we'll stop all that. So it's really a plan to give the opportunity to all people to put the right conditions in place for the protection of workers and students.
Thank you. And as a second question, the entire education community is nervous and confused. Are we opening schools too quickly?
I don't think so. For sure, in regions, the situation is under control, and there's no reason to believe that the situation will be different in 6 months from now. So, yes, there are some risks. Children have a very low risk of getting bad consequences. So we're doing, and we're putting in the balance also the fact that for a child not going to school for 6 months, it's not good for the child.
Thank you. Now the next question is from Phil Autier, Montreal Gazette, also for you, Mr. Legault. On Wednesday, you said 400 soldiers were on their way to help in aid CHSLDs. Can you tell us how many are actually working today in CHSLDs? Last week, you said the healthcare system was short of a few thousands of workers. What is the status today? How many vacant positions are there to fill?
Okay. Right now, we have 10,500 people that are absent. We have 7,200 people that we've hired and are working now, coming from the website Je Contribue. We have 1,200 students and teachers that are working right now in our system. We have 241 soldiers that are working now in our system, and we are supposed to get 276 more soon. That's all what I have.
Thank you. And now for Mr. Arruda's very last question. Many people are worried about the situation in Montreal North. Can you tell us what you know about the outbreak today? How many people have died there? Is the situation out of control?
Actually, there is a hotspot over there. I know that there is a quantity of people who are, I would say, health workers, around 200. I think that's the number I have, but I need to get more information from the investigation done by Montreal, actually, in that place. Probably that the virus was introduced there through, I would say, through workers working in CHSLDs that were asymptomatic and came back. There is a higher risk of vulnerability in that population because of the socioeconomic level, because of the crowding of the people in families. That's all factors that makes that thing. But actually, people are being taken care. People, outbreaks or families who have cases are investigated to offer them care or understand and make them in quarantine if needed. And there's going to be a specific, I would say, screening done tomorrow and on the next days, specifically in Saint-Michel and around places there. And there is also some issues in some communities in Laval.
Thank you very much. So that's all the time we have. Si je comprends bien,
if I understand correctly, we won't necessarily see each other every day. No, it will be 3 days per week now. All right, so see you Monday. Yeah, I don't want people to get tired of seeing us. So look, you can look at us on the days off. Maybe you'll be able to hear you when you ask yourselves questions. It'll, you know, it's kind of like a vaccine that we're doing, you know. Thank you, everyone. But we also want you to all rest.